Again, class, please remember that acronym FAST. Face, arm, speech, and time. Next, let's look at choking. Even though we didn't cover CPR with an AED, we are going to go into how to handle a situation where an adult is choking. The first one will be a choking adult. Here we go.
Choking is a common breathing emergency, and it occurs when a person's airway is blocked. If the person is unable to cough, speak, or breathe, you'll perform 5 back blows followed by 5 abdominal thrusts. Doing these 2 actions in a cycle will help dislodge whatever food or object may be blocking the airway. Your body position is very important for effective back blows. Stand to the side of the choking individual with your feet about shoulder width apart. Turn your body towards the person and place one arm across their chest, like this. Bend the person at the waist and use the heel of the hand in the center of the upper back, right between the shoulder blades. For abdominal thrusts, stand behind the choking individual. Make a fist with one hand, with the thumb facing in towards the person's stomach, and place the fist against the person's torso, just above the navel. Grasp your fist with your other hand and bring it in and up in a swift movement into the person's abdomen. If you are unable to reach around the person's abdomen or the person is pregnant, give chest thrusts instead. Give chest thrusts in the same place you would for CPR, in the center of the chest on the lower half of the breastbone. Continue this cycle of 5 back blows and 5 abdominal or chest thrusts until the object is forced out, the person is able to cough forcefully, talk, or breathe, or the person becomes unresponsive.
Okay, pause there. You can look through those. If you think about where you perform the abdominal thrusts and or CPR, you at the end of your sternum, you take 2 fingers right at the end, and that's called your xiphoid process. There's a little bone that sticks there, but you want to take that thumb right there below that, and with the clasp, and we're going to go through the activity as of right now. Here we go. Go through the mission.
It looks like Melanie needs your help. Time to step in and take action. Before you help her, however, you need to make sure the scene is safe. There doesn't seem to be anything dangerous on this side of the room. This side of the room doesn't appear to have any hazards. Good work. You've checked the entire scene for hazards and determined it is safe. While checking, you didn't notice any severe life-threatening bleeding. When providing care for a choking individual, you need to make sure the person's airway is really blocked and no air can pass through. If the person can cough or breathe, encourage them to continue coughing forcefully. If the person cannot breathe, cough, talk, or make sound, like Melanie here, send someone to call 911 and bring an AED and first aid kit, obtain consent, and then begin providing care right away. That's correct. Before you help Melanie, you should obtain her consent to help. Now, what should you say to obtain consent?
Look through these 3. She can't respond.
Work. In a choking emergency, obtaining consent might sound something like this. It looks like you're choking and can't breathe. I'm trained to respond in breathing emergencies, so I'm going to do a series of back blows and abdominal thrusts to help you. Is that okay? Now that you've obtained consent, begin providing care right away.
Okay, let's see. We're going to send Claire to 911, call 911, get an AED.
Okay, I'll be right back.
Good work. During a choking emergency, it's a good idea to send someone to call 911 and get an AED. This way, you can use the AED right away if the person becomes unresponsive. Since she can't breathe, speak, or cough, Melanie will need back blows and abdominal thrusts. Select Melanie to obtain consent, and then begin providing care right away.
Okay, we select. We already did obtain consent.
Drag the correct hand to the correct spot on the back to prepare for back blows. That's correct. Now you're ready to give back blows. Press the back in the correct spot to give a back blow. When you've completed 5 back blows, select the Done button. Nice work. Next, move on to abdominal thrusts.
Okay, I called 911. They'll be here soon.
Drag the correct fist to the abdomen. Then cover the fist with the correct hand. That's right. Now you're ready to give abdominal thrusts. Press the abdomen in the correct spot to give abdominal thrusts. When you've completed 5 abdominal thrusts, select the Done button. Good work. The abdominal thrusts have freed the obstruction, and Melanie is able to breathe again. She's a little shaken up, but she's going to be fine. Nice job.
Okay, we're going to pause right here 1 second. Had to pause for seconds there to check on my dog was at the door barking. So that being said, now let's go to an unresponsive adult that is choking.
When back blows and abdominal thrusts aren't enough, or a person's airway has been blocked for too long, a choking person might become unresponsive. If this happens, you should carefully lower the person to the ground, making sure to support the head and neck. Once the person is on the ground, start CPR right away, beginning with 30 compressions. As you open the airway to give rescue breaths, look in the person's mouth for any visible blockage. If you can see the object blocking the airway, use a finger sweep motion to remove it. If you don't see the object, do not put your finger in the person's mouth. Just continue CPR. Remember, never try more than 2 rescue breaths during 1 cycle of CPR, even if the chest doesn't rise. Continuing a cycle of 30 compressions and 2 rescue breaths is the most effective way to provide care. Even if the breaths don't seem to be working, compressions may help clear the airway by moving the blockage in the airway up to the mouth, where it can be removed. When back blows and abdominal thrusts aren't enough, or a person's airway has been blocked for too long.
Okay, we're going to go into the unresponsive, and we'll see how we start the mission, and we're ready to roll. Here we go.
Use the check, call, care process to respond to this emergency.
We're going to look to the right. Looks good.
Good. You've checked the scene, and there don't appear to be any hazards. The scene is safe. While checking, you didn't notice any severe, life-threatening bleeding. Tom is unable to cough, speak, or breathe. What should you say to Tom?
Okay, Tom obviously can't talk, and that's a big descriptor of a blocked airway. So we contain consent. We have a bystander. We're going to ask Mandy to go 911.
911. We don't have an AED here.
Okay, so we take our hand.
That's correct. Now you're ready to give back blows. Good work.
Go to abdominal thrusts. Again, we're going to give 5. We're going to take the thumb, put it right below. Whoops, that's me. Take the thumb, put it right below. You know, it's hard to see. Cover it with the other hand.
That's right. Now you're ready to give abdominal thrusts.
There we go. 5. 1, 2, 3, 4, 5.
Good work.
We did those 2. We already did that. We already got the 911.
Mandy is already helping you.
We already checked the scene. We did perform those. And we look like we're doing fairly well.
Tom is unable to cough, speak, or
So
breathe.
we repeat again. We already got consent. We'll pause right there.
Start CPR right away.
Okay, so we put Tom, wasn't responsive. We put Tom down on the floor, make sure he's comfortable. Okay, so when we go here, Check responsiveness. We already know that.
You don't need to do this. You witnessed Tom become unresponsive, so you don't need to check again.
So we're going to look here. Performed compressions. Let's check.
Position yourself for chest compressions.
This is position. Take ourselves. I think we have to put ourselves. Slide over if I can get us in here. Maybe bring the screen up.
Not quite. That's
Okay, so we'll
close to
pause
the
here.
head.
I can't get the screen up. This person's supposed to move for us. Pause. Then I'm going to move the arrow, get myself out of the picture. Move the arrow right to where, right there.
That's not correct. You should be centered at the chest, like this. From this position, you can easily move from compressions to rescue breaths. Take a look at the image in the upper left. Make sure to keep your arms straight and position yourself directly above the chest for effective compressions. If your arms are at an angle or bent, you can't push as hard as you need to. Next, drag the correct hands to the correct location on the chest for compressions. Not quite.
Quite.
Try again. Not exactly.
We're
Use
getting there.
2 hands in the center of the chest on the lower half of the sternum. Well, you're not quite there. You need to give 30 compressions at a rate of 100 to 120
Okay.
compressions per minute.
I didn't go fast
Call
enough.
911. They are sending someone right now.
Okay. So when we went through this, we checked for that. We don't need to move him. We're going to give open airway, check for breathing, give rescue breaths. And when we look at giving rescue breaths, we have to tilt to.
Did you notice that the chest didn't rise? That's because the obstruction is still blocking the airway. Before giving rescue breaths, you should make sure to look in the patient's mouth and remove any visible objects. Continue with CPR now, but remember to look before giving another set of rescue breaths.
Okay, we're going to stop there.